I want to turn to some questions that we received from Coloradans who are still waiting for the vaccine. A lot of folks wrote in with very specific questions about their own health conditions or those of their family and when they're going to become vaccine eligible. And I hope that maybe by tackling some of these specific questions, we could at least give similarly situated Coloradans an idea of when they will be able to get vaccinated. So let's hear from some of the folks who are still waiting. Here's Skylar Hull from Broomfield.
Hi, my name is Skylar Hull. I am 29 years old. I have cerebral palsy, epilepsy, and I'm high risk for getting pneumonia. I was in the hospital in December for aspiration pneumonia. I am wondering how, when, and where can I get my COVID-19 vaccine? Thank you.
So Skylar there listed some of his medical conditions. I think a lot of Coloradans have gone online. They've looked at the chart that the state puts out, and it lists a bunch of high-risk medical conditions very specifically. If we could bring in the state epidemiologist, Dr. Rachel HERLIHY, to discuss this. Dr. HERLIHY, you heard Skylar mention some of his medical conditions, cerebral palsy, epilepsy, so forth. I didn't see those listed on the state's vaccine schedule as high-risk conditions. Is there a larger list beyond what we see, or are we to take the state's vaccine distribution schedule and say that somebody like Skylar is in the general population then?
Yes, I think it's important for Coloradans to know that we are really following CDC guidance and following the evidence base that exists for conditions where we see increased risk associated with COVID-19 infection. So conditions where we see increased risk of hospitalization, increased risk of death associated with those particular diseases. I do think it is important to also point out that there is language in those recommendations around individuals with disabilities, and so that is certainly an important group as well that should be prioritized for a vaccine, and certainly is in Colorado.
And certainly different groups in the medical space have different opinions on who should qualify where in the process. Know that the Global Down Syndrome Initiative refers to folks with Down syndrome as being at higher risk. That again is not a high risk condition that I saw on the state's vaccine schedule. Got a question, Dr. HERLIHY, from Amanda Blankenship. Let's listen.
Hi, Governor. This is Amanda Blankenship. I have Down syndrome. I have a hole in my heart, and when I get the vaccine, so let's get this over with, and have a good night. Thank you.
Dr. HERLIHY, if you could speak to Down syndrome specifically, and then more broadly to folks who are immunocompromised or are on immunosuppressant drugs. How did the state decide where they're going to end up in the system?
Yeah, again, so I would point folks to CDC's website that has really great information and lists out the evidence base that exists for different conditions. And so really these conditions that we've prioritized here in Colorado are based on the evidence and the science that exists. And CDC has some nice websites where they talk through the different evidence that exists. They give references for various conditions and how they are prioritizing various conditions for vaccine prioritization.
Has Colorado prioritized our neighbors with Down syndrome?
I would need to turn to Scott Bookman for that question.
Certainly. I think it may just take us a second to pull Scott up, but we can do that. Because I think what happens is a lot of people look at the same chart that I looked at, and when they don't see a condition, they have future questions about it. Mr. Bookman, do you have any clarification for Amanda Blankenship on where Coloradans with Down syndrome are on the vaccine schedule?
Well, any disability that would prevent somebody from wearing a mask or social distancing is included in our prioritization, and so any further information can be found on our website.
How about folks who are immunocompromised or are on immunosuppressants? Do they receive any prioritization in Colorado's schedule, Mr. Bookman?
Again, we want to refer people to the website and really look into that specific to their condition, and then consult with their healthcare provider as well.
I would note for the record that I don't see any of those things listed on here, and I guess folks are just going to have to go to the website.